welcome. Here we are in the last video of a series on medical ethics. And fittingly, we'll be looking at the last chapter of this book, Medical Ethics, a very short introduction by Michael Dunn and Tony Hope. This is the second edition of this lovely little book from Oxford University Press. And what we want to do in this final session is think about the future, right? Not only do we look back when we do ethics, trying to think about things that we've gotten right, things that we've learned how to do better, and oftentimes in medical ethics we learn about cases of where things went wrong. We can also look at the question of how we're going to move forward in the way that we set up our healthcare systems, how we provide that healthcare. So here's the plan for today. One thing I want to do is talk about philosophy a little bit and circle back to one of the main characters in the story of philosophy. This is Socrates, right? So we'll talk about Socrates and the unexamined life. We'll talk for a moment about new and emerging technologies, and then I'll leave you with some final questions in this brief video. So, Socrates. You might know that Socrates is a very famous philosopher, although he never wrote anything himself. In fact, the way that we know about Socrates nowadays is mainly because of one of his students. His student Plato wrote a bunch of dialogues, these philosophical texts of people talking with one another. And instead of having Plato as a character, oftentimes the main philosophical character advancing a theory was Socrates. Now, one thing that we might know about Socrates famously is that in one of Plato's dialogues, and this is corroborated by the historical record, Socrates was put to death by the people of Athens. Basically, a large jury of about 500 people voted him to be guilty for disrespecting the gods. They called this impiety, as well as for corrupting the youth of Athens by gaining these followers in his philosophical ways. And eventually, this jury of about 500 people ruled that Socrates should be put to death. And it was partly because we'll notice that sometimes asking a philosophical question can be really a bothersome thing. People have a tendency to think, well, this is the way that things are done, and that's all there is to it, and that's how we're going to do things. That's not a very philosophical approach, right? So when somebody like Socrates comes along playing the role of a gadfly, the sort of figure who is bothering people, pestering them to be less complacent. That was Socrates' metaphor of the gadfly, that it was an annoying little fly buzzing around a big, complacent horse. Right? Now, when Socrates is put on trial, one of the options that he's given is that he just shut his mouth and maybe move to another city. But he says, if I do that, they'll probably drive me out of that city for philosophizing at them. And he ultimately says he would rather be put to death than be shut up. And in this context, he tells us that the unexamined life is not worth living. So part of what Socrates seems to be telling us here is that part of living a genuine and flourishing human life, you cannot help but philosophize in the process of living a good life. He says, if you're going to live a life worth living, he says, you're going to have to examine your life. So I'd invite you to reflect on this. What sorts of questions do we have to think about in order to examine our own lives? And beyond philosophy, it might be questions like, what kind of thing am I? Am I an animal? Am I a soul? Am I some combination of the two? What is important in my life? What sorts of things do I have to do to be good? What sorts of things do I have to do in order to be happy? These are big philosophical questions, and it seems like Socrates is going to tell us you're not really living a full human life if you're not reflecting on and trying to work out an answer to these questions for yourself. Here's another thing that we can notice, is that these questions of the examined life, who am I, where am I going, what's really important, those are questions we have to ask in the context of medicine. Right? We can even ask the question, what is the goal of good medicine? In that paper by Leon Kass about euthanasia, he even proposed an answer to that question. He seemed to suggest that, well, the whole point of medicine is to heal the sick, right? And that we will do medicine well, and we will be able to examine our careers and be satisfied with them when we realize that our job is to heal people. He says, ultimately, we owe medical care to our patients because they are sick, not because they have rights, not because they want it, not for society, and not for the sake of what a health insurance company wants. It's to serve a patient, and it's to bring them to a level of healing. Now, we'll notice that other philosophers from this course may give us different answers. Right? We might think that in some cases, we might decide that autonomy or non-maleficence, right, other values in medicine, might override this desire of healthcare practitioners to heal others. Right? We could also ask a question like, what is a life lived well for ourselves and for others? If you're going to be a healthcare professional, you might ask, well, how can I be happy in the context of being, say, a doctor or a nurse? This is hard work. And we might also ask, what do we owe to our patients? Do we have to put our own lives on the line? Do we have to put our own mental health on the line? And in some contexts, I've seen healthcare workers say, yes, you've got to make large sacrifices as a healthcare worker. Although I've also seen, within the context of healthcare, a reasonable desire of healthcare workers to put themselves first. So again, these are questions. These are big philosophical questions about what's really going on and what to care about. And in that way, these Socratic questions and the Socratic challenge, right? Socrates' challenge was, you must examine your life, right? And we're going to see that there is no escaping the big philosophical questions in medicine, whether as a practitioner or as a recipient of healthcare, if we're going to do this thing right. Now, here's another sort of plea for the importance of philosophy. We can also talk about the ways in which healthcare is changing, and it's changing so often. Right? Think about new and emerging technologies. So we could think about things like genetic enhancement. So there are things like pre-implantation genetic diagnosis within the context of IVF and genetic technologies. We've got to ask questions, and we have asked questions in this course about whether screening against something like a disability is something that is ethically acceptable. We often hear these concerns about so-called designer babies. To what extent should we be fulfilling people's tastes? Maybe they would prefer to have a blue-eyed baby, or they would prefer to have a baby of a certain sex, or they would prefer to have a baby that does not have a genetic condition that other members of their family have had. So we get big value questions as these technologies get more and more advanced and become more and more real. We will often hear about reasons why it is not acceptable to use CRISPR gene editing technology in germline cells, that is, in cells that will reproduce and be passed to the next generation if this genetically edited person decides to reproduce. Well, we should also notice that CRISPR technology is being used on somatic cells. This is like cells that won't necessarily be passed down to the next generation. And we might worry about using technologies like CRISPR on human beings, but we should also notice that there are some amazing things being done with gene therapies nowadays. So there's a fascinating case involving how a cancer researcher was able to use CRISPR to genetically edit T cells. Now, a T cell is a cell that does work for your immune system. And they found a way to use CRISPR to edit the T cells, put these new edited T cells back into the patient's body. And in one case, they were able to cure a young girl of her cancer. So there are reasons for caution, but we might also notice that there are reasons to be excited about the advancement and the implementation of new technologies within healthcare. Another thing, and this is becoming more and more of a topic all the time, think about artificial intelligence within healthcare, right? So we might wonder, would you want your symptoms to be collected by a computer and have an artificial intelligence giving you diagnoses and health recommendations? It seems like many people wouldn't. But we might notice that there is increasing use of computing and algorithms for medical decision-making and diagnosis. They've even used AI to discover and develop new drug recipes that have been immensely helpful. I know some people who have done work in using AI to make the process of doing medical charts briefer and easier for healthcare providers. You might think that could be a good thing because it means that doctors could spend more of their time caring for patients and less of their time worrying about paperwork and charting. So I think that within these questions, again, we've got to examine our lives. We've got to think philosophically, right? Part of what we can say is humanities and philosophical thinking allow us to stop and ask questions. Well, we have these new technological capabilities. Should we use them, right? And so one way we can examine our life and examine our work and the way that we do healthcare is to think about these questions of what makes you hopeful, but also what maybe we should be worried about. Note that changes in healthcare will be partly technological. We will be able to do things in 10 or 20 years that we're not able to do now. But there will also be cultural questions, right? So we're going to have to think about the extent to which it's important to us to address certain inequities within the healthcare system. We'll have to think, for instance, about what sorts of values we're going to protect and promote, possibly the next time a pandemic happens. And we might also have to ask the question, how are we going to deal with good information and bad information as it spreads throughout the internet? So here, we're finding that, again, there is no getting away from asking big value questions, and in effect, there is no getting away from thinking philosophically. So here are just two final questions that I'll leave you with. What areas for ethical improvement do you see in healthcare? We might even ask, like 20 years from now or 50 years from now, what will people say we did badly, right? What will people say, well, we wish that they would have come to a realization of the right thing to do sooner? So, in a certain way, when I ask this question, what are the problems as you see them? And maybe we can also ask the question of, what are we going to do about them, right? So that's one thing to think about. Last thing to ask, how will you take knowledge from this course into the world? Right. One thing that we've done is we've looked at numerous difficult cases, right? From, say, the really shocking case of Dax Cowart being treated against his will. Maybe also comparing that to the stories that Gowande tells about maybe bad healthcare that seems to emerge sometimes when we act according to the patient's will in the wrong way. Or we might look at the case of the 17-year-old in Connecticut who was required to receive chemotherapy even though she and her parent did not seem to want that treatment. Or we can think about cases involving racial bias or gender-based bias within healthcare. Right, so we can notice all these mistakes that have happened throughout the history of healthcare. Another thing I'd encourage you to think about is how throughout healthcare we see recurring principles at work. Right? The 4 principles of medical ethics being autonomy, act on the patient's wishes, make sure that they have full information. Beneficence, do what you can to help the patient. But non-maleficence, make sure to not harm the patient. And then we can ask about justice, right? Are the benefits and burdens in this situation being distributed equally or fairly? And are we making sure that the way we're doing things is not violating the rights of others? In fact, when you encounter a difficult case, you might even be able to just stop and think about how you might answer each of those questions in a particular case. And in a certain way, that's a large part of how we think philosophically about big ethical questions in medicine. And it really is a way of living that examined life as a provider or a recipient of healthcare. So I'll leave you with that to reflect on. Thank you for listening in. As always, if you have any questions or concerns, please don't hesitate to reach out, and take care.